So earlier on we spoke about what polyostotic bone lesions. Polyostotic bone lesions. So we just said that polyostotic bone lesions are usually caused by what? Fibrous dysplasia. What is fibrous dysplasia? Fibrous dysplasia is when your bones are getting replaced by what? Some fibrous tissues. So primarily you are having weak bones, you are having that risk of what? Your bones getting fractured and all of that. Okay. So say that if it is polyostotic, it is now affecting what? Different bones. Then if it is monostotic, just like the word mono means one. So this one is affecting just one bone. You get? So for this polyostotic, coming, my phone is kind of like twisted on my laptop charger, so it's making it malfunction. For the monostotic, we'll go from the definition to the possible causes, all right, to the symptoms, to the diagnosis and treatment. Okay, so monostotic, just affecting one bone. Okay, could be different parts of that bone, but just one bone. So you see that monostotic lesions are abnormalities or lesions in a single bone. Do you understand? Here you can see that what they are on different parts of the bone, but it's the same bone. You get? So this can be benign or malignant. They can be benign or malignant, and they actually arise due to what? Various causes. Okay. So let's look at the key points on this monostotic bone lesions. So causes could be benign lesions. So conditions like what? Fibrous dysplasia, osteochondroma, bone islands. That's basically what? Enostosis. Then we could have malignant conditions like what? Primary bone cancers like what? Osteosarcoma, chondrosarcoma, all of that. It could be some infections like what? Bacterial osteomyelitis. That's bacterial infection of the bone. Okay. This one can also cause some aggressive monostotic lesions. The symptoms is basically there will be pain, and that pain is localized to the affected bone. Okay. Then swelling will also be visible around the lesion. Fractures, your bones are weak, so they are prone to what? Become fractured. There's some non-specific symptoms like what? Fatigue. That one you are weak even after resting. Okay. Then also weight loss. All of these can actually be present in the malignant cases. Okay. So diagnosis is basically imaging, where you things like CT scan, X-rays, MRI. All this just to visualize the lesion and assess the characteristics. Then biopsy is what? You take a sample of that bone, send it to the lab for like lab tests and all of that. Treatment is, yeah, you can just be observing it if it is still small and if it is not causing any symptoms. Okay, like all these symptoms that we listed out here. If these symptoms are not on ground yet, you can just observe first. Then if you're having symptomatic ones, you might want to do a surgery. All right, you might want to do a surgery just to remove or stabilize the lesion. Then medications is basically what? Pain management, and if it is something that is causing it, you might want to now address the underlying cause. Okay. So on that basis, that's it for what? Monostotic bone lesions.